deeply committed to the well-being of rural communities. She completed her undergraduate studies at the University of Nevada, Reno, and earned her Doctor of Medicine degree from the University of Nevada School of Medicine. For 37 years, Dr. Titus served as a dedicated family physician, providing compassionate care to the residents of southern Lyon County. Her firsthand experience as a rural healthcare provider has shaped her strong advocacy for improving access to quality healthcare in Nevada's rural areas. Senator Titus currently serves as the Senate Republican leader, having previously served as the Assembly Republican leader. Throughout her distinguished career in both medicine and public service, she has remained a steadfast voice for rural Nevada, championing issues that strengthen communities, support families, and expand healthcare access across our state. It's my honor to introduce my friend and physician.
So, first and foremost, I'm quite impressed with the acoustics in this building. We can do a lot of statements in this room, and the acoustics are quite impressive. Thanks for the invitation, Kathy, Tony, for having me here. Tony, great history of this facility. As she stated, I graduated from medical school in 1981, but the key component to all of that is that this county paid my way through medical school. And that's really what I want to focus on today, is how it's really about a community. This whole facility, the healthcare in this community, is because community members, Alice Rees, I will tell you all the board members over a period of time that have been a component of this facility. From your Lori Watley, Chief of Nursing, who's been here, started in a paperwork kind of position and billing, yeah. And then, this facility helped her get through schools to be an RN. We have med techs that were front office people, signing people in, that went on to school to now be in your lab. We have providers like myself that this community paid and supported to come back and be part of our community. And I think that's the way this facility has continued to survive. Tony gave you a little history of the process of how this became a vibrant, very busy facility. And I rotated here as a junior medical student when we were doing a rural rotation and with Dr. Beams. And we would go in here, we were doing deliveries, we were doing surgeries. Jen Brethel, her office was down the hall here. She was going out of her office so they could use it as a patient room because we were so busy. And then as Tony mentioned, the facility dramatically changed when the town changed. And again, it's about the community because Anaconda closed. When Anaconda closed, this facility barely survived. With that, the foresight of the people, again, community, Bev Landau, many others who said, Carolyn Strohsnyder, who said, listen, we have to save this facility. Coming through many iterations of what that looked like, and finally settling again a community. Going on the ballot to vote for a tax. Fundamentally, politically, I don't support taxes. However, if a community votes for that tax, huge difference. This community overwhelmingly, the county did, overwhelmingly voted to help fund it and add a tax. That's just hard to believe, generally, but not a surprise about this community, because that is what it's all about. I did do deliveries here, but again, for years, 2 years, and then it was kind of a liability issue. My malpractice was going to go up from $9,000 a year to over $30,000 a year. And my 50 deliveries a year could not pay, I couldn't charge them enough to cover that. Interesting sidebar, Connie Chung, and those of us who are old enough to remember Connie Chung, had a news reporter. She had something called a Fall Harvest TV show. And it was a time where many of us in primary care were giving up OB because we couldn't afford it any longer because of liability. So she flew out here and spent a week with me. And we made house calls together. Dr. Mary I had her as a patient here in this facility. And, you know, Dr. Mary delivered like 5,000 babies and never was sued. But the reality is, in those days, it was God's will, so bad outcomes, but it wasn't anybody's fault. And now it's, well, who's gonna pay for it? And it's a lifelong payment. And so it was a big deal. And then, like I said, we made house calls together. I went out to my farm. I was quite impressed because I showed up at my mother-in-law's ranch where PJ Fry lives now with horses. And I showed up at my mother-in-law's ranch with Connie Chung. And she was like, oh my God, she had to go back in the house and change and come back. Funny stories. And you know, Dr. Mary was here again. As I said, she never was sued, and any kind of recognition of this building, of this hospital, of healthcare in Mason Valley, Smith Valley, all of Lyon County wouldn't even be half justified if we didn't mention Dr. Mary. Dr. Mary actually delivered my mother, and it was she who enabled me to kind of come back and have that acceptance of women as providers. And even the old farmers in Smith Valley, it was okay to come to me. Now, some of the high school kids wouldn't go out to football because I would do their sports physicals, and everybody knew I was going to do a hernia check on them. And some of them just couldn't get past that. They never went out for sports. But Dr. Mary really did open the doors for me, and as I said, I had the pleasure of taking care of her. And as I would drive down here, because I had my office here, where it used to be the veterinarian's office. That was my office. That was Dr. Beams' office. And I would see patients in my home in Smith Valley. And then I'd go by Dr. Mary's house on my way down here, and she'd tell me how healthcare was just destroyed. And ultimately, as she got older and older, she became more appreciative that I would come by and do a house call on her. But the other thing that has changed in healthcare is medical records, and there's people here in the medical records department. So when I took over for Dr. Mary in 1984, I went into her office, and the gal who was taking care of her and I said, well, can I have your records? And so, sure. So she goes down in the basement, and she gives me one box of a woman who'd been practicing from 1918 until I took over her practice in 1984. Her entire medical records, and in there would be so-and-so, penicillin shot. And then the next, talk about concise medical records. And now, of course, we have volumes. When I left Caleb was, 10,000 charts, right? The difference, and I only practiced for 37 years, although I'm still your county health officer, so I consider myself still practicing. But I guess, again, if I leave you with nothing, I want to emphasize for all of you working here, board members that are here, just people who are here, the Battleborn. I wore my Nevada t-shirt for Battleborn today because really Nevada is Battleborn, but communities sometimes are Battleborn too. And without a community, this place would not exist. Without the hard work, passion of community members, employees, because you all are really sure, Billy, you show it right now in my passion. So Blaine is the executive director of the Nevada Rural Hospital Association, and he's been an integral part of also. And one other person that I didn't mention yet about community support is his predecessor, Joan Hall. She's not here today, and I would say that Joan Hall and I, and Tony was here when I started as a, what was your first job, Tony?
I was marketing. I was first initially, my profession is a reporter, so I was actually, the hospital was my dean.
Yeah.
And Eddie was the administrator, Joan was assistant in 1992.
Yeah, she was just a baby nurse coming out of school of nursing, Joan Hall was.
Yeah.
I was frankly a baby doll. I never thought I was a baby anything, I was always in charge, but I was still just a pup in this whole world. And Tony, Lori, Joan Hall, myself, as we've seen this progress, and back to what I was saying before, so rudely interrupted by Blaine, this is, again, a community. We've survived good times, bad times, moderate times, and again, it's all survival. It's about who you have there to survive with. And we are surviving because of everybody in this room that care, that show up. And I didn't mention our pharmacist who's been dedicated to, because there isn't a department that hasn't had some person that has just been passionate about being in this community and making sure we survive. So I want to thank you for all being here.